Welcome back to Your Dialysis Nurse. My name is Nicole, and this is Peritoneal Basics Part 5. If you watch Part 3 of my series, I briefly discussed different solutions for PD. So now let's get into a few scenarios where a patient may use this solution. Disclaimer, I am not an MD and I am not telling you how to make a prescription. Now let's get started. Scenario number 1. There is a patient that is complaining of a headache post-dialysis. You assess the patient and find that the patient's skin is dry, no edema noted. Their flow sheets in the past few days show that they have been hypotensive. You further assess and the patient is eating at least 3 times a day and fluid intake is being monitored and controlled. They are currently prescribed a 2.5% dextrose solution. What solution do you think this patient can benefit from? Keep in mind, the 4.25% has a red pull ring and it pulls off the most amount of fluid in a 4-hour exchange. The 2.5% has a green pull ring and it pulls off some but not too much fluid in a 4-hour exchange. The 1.5% solution has a yellow pull ring and it pulls off the least amount of fluid in a 4-hour exchange. Answer. This patient can most benefit from a solution that is not going to pull off too much fluid during exchanges. Because this patient is showing signs and symptoms of dehydration, the patient needs dialysis to clean the blood, but we want to minimize how much fluid we are removing. So 1.5% would be best for this patient. Scenario number 2. There is a patient that is complaining of shortness of breath upon arrival to clinic. You noted facial swelling and 2% edema noted on lower legs bilateral. You noted diminished breath sounds upon auscultation and you inquire about total daily fluid intake. Unfortunately, the patient is unable to recall. What solution do you think the patient can benefit from? Answer. This patient can most benefit from a 4.25% solution. Because this patient is showing signs and symptoms of fluid overload, we want to remove as much fluid as we can and safely can in a 4-hour dwell time, okay? Scenario number 3. Your patient arrives to clinic and states they feel good and they have no complaints. Your assessment concludes that the patient has 1+ edema noted on lower legs bilateral stage 2 hypertension and is drinking approximately 70 ounces of fluid a day. What solution do you think the patient can benefit from? This patient can most benefit from a solution that is going to pull off a little more fluid, but not too much in a 2 to 4 hour dwell time. The patient is doing excellent with monitoring their fluid intake, but needs a little help removing the extra fluids they're consuming. They would most benefit from a 2.5% solution. But please keep in mind that other factors play a part in fluid removal too, especially if a patient is on diuretics or has not been prescribed diuretics yet. Also, molding a prescription can get very complicated for a beginner. This is just scratching the surface and keeping it very simple. With every patient, you need to consider their membrane type. In some cases, a patient will not have to worry about switching out their solution because they are on one that requires a long dwell, which would be called extra nil and requires a minimum dwell time of 8 hours. Now, I personally love the use of extra nil for patients. It shows that the MD is really putting the patient needs before cost, but that's just my personal opinion. Thanks for tuning in to Your Dialysis Nurse. Please make sure to share this with a nurse who is interested in peritoneal dialysis. And don't forget to like the video if you enjoyed it and subscribe to the channel to stay up to date with all videos that are uploaded. Blessings, Your Dialysis Nurse.